Hello. We are presenting today on home birth versus hospital birth.
So some key terms that are important to know are what's a home birth, which is delivering at home, often without the assistance of a midwife and or doula. A midwife is an individual who delivers a baby, often in a home. They may first become nurses and receive certification to practice as midwives, or they might not have any certification, then receive some training, and then enter the workforce. Not all states certify or legally recognize midwives. And then a doula, they have no medical experience, but they can provide support and information to mothers before, during, and after childbirth. There are very few requirements for becoming a doula, but they can go through formal training or certification.
Some other terms to know is a C-section. A C-section is also referred to as a cesarean section. This is done when an infant is in an unsafe position for vaginal delivery. It's a surgical procedure where the doctor will cut an incision along the abdomen and into the uterus, and the baby will come out through that incision. Another term is high-risk pregnancy. This can include a number of factors, including abnormal fetal heart rate, abnormal position of the fetus during birth, problems with labor, size of the fetus, twins or other multiples, and or previous C-sections. The final term we want you to know is APGAR. An APGAR is a quick test performed immediately after the baby is born at 1 minute and 5 minutes after birth. The 1 minute score determines how well the baby tolerated the birthing process, going through the canal, getting pulled out of the uterus, whatever it is. And then the 5 minute score tells the healthcare provider how well the baby is doing outside of the mother's womb. So it just helps them be aware of how well this baby is going to survive the next couple of days, weeks, months, and years.
So this diagram shows different positions a baby could be delivered. So the top is the preferred method, head down, face down, but sometimes babies are coming down out feet first, which is considered breech. So it could be both feet, or it could be their bottoms coming out first, or one foot's coming out, or even a shoulder could be coming out first. And so all of those situations would necessitate a C-section traditionally.
So just going into the trends and data on home births, the number of home births has increased by 77% in the United States in the past 15 years. In the United States, approximately 35,000 births, or just barely under 1% per year, occur in the home, which is a lot. And approximately 1/4 of these births are unplanned or unattended.
The American College of Obstetricians and Gynecologists does not recommend planned home births. A study in the New England Journal of Medicine in 2015 found that planned home births were associated with higher rates of perinatal deaths than planned in hospital births. So it was 3.9 deaths at home versus 1.8 deaths in a hospital for every 1,000 deliveries. And lastly, the study also found that the rates of infant seizures were higher, and babies were less likely to be admitted into the NICU after delivery.
So just kind of looking at this graph, you can see that hospital births by far have the lowest rate of infant mortality compared to any other type of birth, those three on the left being home births.
So why would someone want a home birth? Well, there are many reasons, and a lot can be very appealing. Sometimes women don't want medical interventions, such as an epidural or being induced. They don't want the baby's heart rate being monitored, and they would like to deliver without forceps or other instruments. They want to give birth in a comfortable or familiar place. Maybe they've had previous experiences with hospital staff that have been uncomfortable or undesirable. Sometimes they want to have control of the birthing process and have their own birth plan being followed. Sometimes people have cultural religious reasons, which is why they may prefer to deliver at home. Sometimes people don't have access to transportation or even access to a local hospital, and it is significantly lower cost to deliver at home.
So going into why a hospital birth. Hospitals are a good choice for women with health problems or pregnancy complications, like we talked about before. Those can include fetal heart rate problems, previous C-sections, or any type of breech baby. A hospital setting can provide the maximum level of medical support for labor, birth, and newborn care. So they're going to be able to follow up with you and the baby separately and together to see how everyone is recovering from the birthing process. Any hospital which offers maternity care can manage full-term deliveries, which is 37 weeks gestation or more without known complications to the mom or baby. So they are practiced in this. They've done it a lot of times, and they have the personnel and the equipment to handle pregnancies. High-risk conditions, including preterm delivery, are also best managed in a hospital that routinely accepts and cares for these types of patients. Hospitals are the place you want to go if your baby is going to need to be in the NICU or other full-term care. Delivering providers in a hospital can include certified nurse midwives, family physicians, and obstetricians. So instead of just having a midwife or having no one in a home birth, in a hospital birth, you're going to have a plethora of individuals who are there to support you through this process.
So after looking at the trends in both sides of the argument, we are in favor of hospital births for a lot of reasons. Firstly, infant mortality increases with home births. There's a threefold increased risk of neonatal death in planned home births versus those who've planned hospital births.
In the US, there are no strict criteria for midwives or other birth attendants, which means that I could become a midwife without any training, and that is a really unsafe process for some mothers, especially with some of these known complications, because midwives aren't necessarily trained to handle those. And with statistics on that, 1.3 in 1,000 mothers and 0.76 in 1,000 babies died among healthy, low-risk pregnancies and home births. These are babies and mothers that could have survived if they had been in a hospital. And comparatively, only 0.4 in 1,000 mothers and 0.17 in 1,000 babies died during a hospital birth, which is a much lower number.
Yeah, researchers have observed that higher rates of perinatal deaths, depressed 5-minute APGAR scores, neonatal seizures, and maternal blood transfusions among planned out-of-hospital births. So pretty much there's more deaths and there's lower APGAR scores, which shows that it's just not as healthy for a baby to be delivered at home. And like we've already mentioned, hospital personnel just have more training, access to medical equipment than midwives do.
So kind of just to conclude, childbirth itself is a very complex and important process, and hospitals are the most well-equipped to handle these complexities. While home births may seem like a comfortable option, there are many unforeseen challenges that can occur during labor and delivery. And if a midwife does not have the experience or equipment necessary for those challenges, a perfectly healthy mother with a low-risk pregnancy could have increased health challenges that could be fatal for her or for her infant. And we want to avoid that as much as possible. So we are recommending that you plan your birth in a hospital.
Yep, choose hospital, not home. Thank you.
Thank you.